COVID-19 has consumed our life.
It was a slow rise of anxiety, and then it just came upon us, and it came upon us heavy.
We were hit with a tsunami, and we had literally no time to prepare for that.
But this was one that felt that we could not easily fix because we didn't know what we were getting ourselves into.
The patients sometimes don't have a sense of how sick they are.
We didn't have time to prepare, having an ample surplus of PPE.
Families cannot be here with her loved ones, their loved ones. I want to be the one that can reach out to them.
There was constant fears of what are we taking home to our families, and are we safe even to go home to our own houses at this point after leaving the hospital?
Within days, we were confronted with an unbelievable crisis.
There was one patient that struck me very specifically. It was a 32-year-old male who worked in the labor industry, could not leave his job, had 5 days of symptoms coming into the hospital. He waited till the end when he was really sick. And all that he kept asking me was, are you going to put me on a ventilator? And at that point, all I could say is, at this point, we hope not. You're stable. We're going to get you through this. But deep down, I knew that this was not going to end well for this patient. And ultimately, he did end up on a ventilator. And this one struck hard because he had no other medical history. He told me he had 2 young children at home. And he felt like it could be any one of us. So that in itself was kind of the climax tipping point for me that, okay, this is real. This is affecting anybody and everybody. And the young patients are also getting severely ill from this.
Eventually it became just an overwhelming tragedy where we saw patients die, and we couldn't help. Then having colleagues be impacted, it went from the patient to ourselves, and having, seeing colleagues not only suffer from COVID-19, but to also pass away from COVID-19. And it became, this all-encompassing thing that we dealt with every day, and there was no break from it. And so it became very personal.
My brother and my father fell sick with COVID, and me being here in New York and being the only doctor in the family, kind of like the family also wants you to take, the leadership of communication with doctors. My sister-in-law took him to the hospital, and then after one day he was in the ICU. The situation in Spain was very similar to what happened here in the United States. So before I came to work every morning around 6 a.m, I would be calling Spain, trying to get information from my brother and my father. They were in different hospitals. With my father, I knew what was coming. But with my brother was a fighter like, and we didn't know that much about COVID at that time. My brother died on March 30. My father died on March 24. I don't think I have gone through anything that difficult in my life. And I don't know, like sometimes I think, is it something that is going to affect me in the long term? I don't know. I don't have the answer. I know it's going to take time to be completely safe, but a better sense that I can go and see my mother and go to the cemetery and see.
For residents to ask me, if I do get COVID-19, will you please save a ventilator for me? That was the most heartbreaking thing to have to deal with. It's one thing to be able to come to work to help your patients, but to risk your own life to do so, that was extremely overwhelming. This is our job, is to help, to take care of others. But what we ended up facing was the ultimate. You put yourself at risk so that you can care for the patient in front of you.
We've made it through the first wave, and we stabilized, and we were extremely proud of what we've achieved. And despite the losses, we're focusing on how many lives we actually saved. Everybody gave of themselves, no matter what their roles were. Titles went away, red tape went away, barriers went away. We just worked together from a logistics perspective to the bedside, and the employees really rose to the occasion to take care of our community.
The patients who were the most vulnerable were the ones that were also hit the hardest by the pandemic. Racial injustice and the injustice that's basically set up by the infrastructure of our healthcare system was exacerbated during this pandemic. And so with the murder of George Floyd, with the pandemic, all of that came to light.
I've never seen more compassion in healthcare than I have over the last 9 months. It's heartwarming to see, while it's also devastating to see what happened. But to see employees, and I talk about it all the time, how they have become the extension of families, because the families couldn't be there because of visitor restrictions, and there was somebody in the bed, their loved one, and they couldn't be there, and the employees have taken on that responsibility, and they talk about that. I'm the family member now, and we've just had Schwartz rounds recently where employees talked about that. They tried to not be the best healthcare provider, the best nurse they can possibly be. They talked about, I want to be the best family member I can be for that family.
I've been part of Schwartz rounds. I think they're very cathartic. They're very therapeutic. There's a huge return on investment of going to this 45-minute session that's interactive and so relatable. So you feel so much better after leaving these sessions. You feel much more camaraderie with all of the other care team members that are there, having conversations that you would not typically be having on the floors when you're taking care of patients. So there's a huge return on investment on many levels by participating in them. I'm always supported by the whole care team that's in the hospital doing what I'm doing. So surrounding myself with people that are doing the same thing gives me hope.
I believe that what we've learned, especially the elements around compassion, around human-centered care, that will stay.
I think we determine the future. And so we can either go back to being complacent and, allowing healthcare disparities to exist, or we can figure out how we can fix these issues.
Every hospital and healthcare worker in this country has really risen to the occasion. That we should be very proud of, and we should celebrate that and continue to stay vigilant.
It's not just about you or me, it's about us. It's about all together. Because otherwise we cannot survive.